Hello, all you healthy blood pressure warriors. My name is David Fry, and I'm the founder of healthybloodpressure.com. And now, before I start this video, I need to give you a disclaimer, and here it is. Okay, thanks for your patience. In this video, I'm going to talk about one of the common medications that doctors prescribe to control high blood pressure. There's a lot of different types of medications that doctors prescribe to reduce blood pressure. The medication I'm going to talk about in this video is called Losartan. And I'm going to talk about how Losartan works, its side effects, dosages, interactions, and just tackle some frequently asked questions about it. Losartan is a medication that's commonly manufactured by the brand Cozaar. It's a low-cost, generic medication that's often prescribed as a replacement option for other blood pressure medications. So if you've already been taking a medication every day for hypertension and it's giving you bad side effects, your doctor is likely to switch you to Losartan. Although its main job is to lower high blood pressure, Losartan has other uses as well. For instance, if you're a diabetic and you deal with high blood pressure, Losartan might be the right medication for you. This is because it protects your kidneys from damage caused due to high blood sugar. Okay, so now let's talk about how Losartan works, okay? One way to lower blood pressure is to block the Angiotensin 2 receptor. Angiotensin blockers are also called ARBs, which is an acronym for Angiotensin Receptor Blocker. Angiotensin 2 is a hormone in the body that narrows your blood vessels, which increases your blood pressure. Angiotensin 2 also stimulates salt and water retention in the body, which further increases blood pressure. So by blocking Angiotensin 2, it stops your blood vessels from narrowing and allows your blood vessels to relax, causing your blood to flow more freely through your arteries. And that's what Losartan does. It blocks the receptors of Angiotensin 2. And that's why doctors prescribe it to people who are suffering from high blood pressure. Here's a few facts about Losartan. Although Losartan is safe for most adults, in some cases it's not. So who is Losartan not good for? Well, for example, it protects the kidneys from negative effects of diabetes, but for those with different kinds of kidney problems, it can actually worsen the condition. Losartan isn't safe for pregnant women either. It's actually been known to cause birth defects. Breastfeeding women should avoid this medication too. It's also not suitable medication for children below 6 years old. So why do some doctors choose Losartan over other medications? Well, one of the most common reasons your doctor might have to switch Losartan is that it has lower side effects than other high blood pressure medications. If you've been on medications such as Lisinopril, you may have experienced dry cough and swelling. That's why a lot of doctors will take their patients off of Lisinopril and put them on Losartan. Plus, it has added benefits of protecting the kidneys and the heart. Losartan does have some side effects, although the common side effects are manageable and usually go away as your body starts getting used to the medication. In some people, the side effects include dizziness, nausea, headache, diarrhea, and joint pain. Sometimes the medication increases potassium levels in the blood that eventually harm your heart. Losartan can also cause some serious side effects in rare cases. If you notice yellowing of the skin, breathing difficulties, severe weakness, abdominal pain, skin rash, or swelling, talk to your doctor immediately. Okay, what are the dosages you can expect to take of Losartan? Well, usually doctors prescribe either a 50 milligram or 100 milligram tablet of Losartan to be taken once per day to control your high blood pressure. Whatever dosage your doctor prescribes, please stick with that dosage. If you slip up and you forget to take your pill that day, don't worry. Just take it as soon as you remember. But just make sure that there's a sufficient time gap between the dose that you're taking now and your usual time of your next dose. Whenever I mess up and forget to take my kidney transplant medications, if it's not close to the next time I'm supposed to take them, I'll just go ahead and take them right then. But if it's close to the time I'm supposed to take them, I'll just wait until that time and just carry on. All right, the next question you might have is how long does it take to see results from taking Losartan? Well, you'll probably start seeing improvements in about 3 weeks or less. But sometimes it could last longer. If it's been 6 weeks and you don't see any improvement in your side effects, talk to your doctor. In that case, that type of blood pressure medication might not be right for you. Your doctor will decide that. And be sure to measure your blood pressure before you go asking for a change of medication, though. Going just by the physical symptoms doesn't always work. All right, what if Losartan does work for you? Do you have to take it for the rest of your life? Well, the answer to that is most likely yes. You could change your lifestyle habits to be more healthy, and that could definitely lower your blood pressure. But unless your doctor decides to change your medication, you always want to stay on it. And by the way, if you do end up making some lifestyle decisions and you become a lot healthier, there's a good chance that your doctor will take you off those meds. Okay, let's answer a few common questions about Losartan. Many of you might be confused as to whether Losartan is good or bad for your kidneys. Losartan is generally safe for those with no kidney diseases. It also does a good job of preventing kidney failure for people with diabetes. However, if you have a history of kidney-related diseases, Losartan can make it worse. Your doctor will periodically check your kidney function while you're on Losartan to make sure that everything's okay. Okay, how do you take Losartan? Well, it's as simple as taking a pill every day with a glass of water. You can take it either with or without food. But the important thing is that you take the pill at the same time every day. Recent research advises to take your blood pressure meds in the evening before you go to bed. The research says when you do that, you have less risk of illness or death due to heart or blood vessel disease. But don't take that as blanket advice. Always take your meds at the time that your doctor tells you to. All right, what happens if you forget to take your meds? That happens to me every now and then. And if it happens to you, get a pill organizer or a pill reminder app. Missing a dosage once in a blue moon probably isn't going to cause any serious issue. But if it happens regularly, then you do have a problem, because that can lead to serious consequences for your health. Another question is, are there any foods or drinks that you should avoid while you're taking Losartan? And the answer is, there's no restrictions when it comes to food. But a word of caution on low sodium salt. Low sodium salt typically has a high amount of potassium, and Losartan tends to increase potassium levels in your blood. So it's not a good idea to add more potassium to your diet when you're taking Losartan. When it comes to drinking alcohol, it may interact with the effects of this medication. It's best to lower your alcohol intake or completely avoid it altogether. Losartan doesn't interact with any food and doesn't affect your digestion in any way. Well, except for diarrhea as a mild side effect in some people. And again, that should go away once your body adjusts to the medication. So it's safe to take your pill any time of the day, whether on an empty stomach or a full one. Okay, another question is, how about other medications and pain relievers? Do any of them interact with Losartan? Well, it's best to always list out all your medications and give them to your doctor before your doctor prescribes Losartan. It could interfere with other blood pressure medications and medications like diuretics or mental health medications, and most painkillers actually, and also blood thinners. So your doctor should absolutely know what other medications you're taking. If you think you have to take a painkiller, stick to Tylenol and aspirin in lower doses. If you're taking Losartan, do not take painkillers such as ibuprofen, diclofenac, and naproxen. A lot of people confuse Losartan with Losartan Potassium hydrochlorothiazide, and they often wonder whether Losartan can make you urinate frequently. Well, pure Losartan, which is made by Cozaar, has no diuretic effect. But Losartan Potassium hydrochlorothiazide, made by Cozaar, has a diuretic and can make you urinate more frequently. Let's now delve into a little bit of the main differences between Losartan and Lisinopril, which is another commonly prescribed medication to lower blood pressure. I personally take Lisinopril every day. They're similar medications because both strive to lower the levels of Angiotensin 2 in your body. But the way they work is completely different. While Lisinopril blocks the production of angiotensin II, Losartan prevents angiotensin II from binding to its receptors, but the result is the same. They both lower blood pressure. Less angiotensin II in your body causes the relaxation of blood vessels, which then lowers your blood pressure. So, to sum up the pros and cons of Losartan, it's great compared to some of the other blood pressure medications because of its low amount of side effects, and it also protects your kidneys. But the downside of taking Losartan is that it can harm your kidney if you have a kidney-related ailment that is not from diabetes. Losartan can also raise potassium levels in your body. So when you're taking Losartan, make sure you follow the guidance of your doctor and keep them posted if your blood pressure hasn't improved in a month. Call your doctor immediately if you experience any severe side effects. And if you're pregnant, let them know that so they can switch you to a different medication. And lastly, continue to take your pills even if you feel all right. Unless your doctor tells you to quit, please continue to be faithful in taking your meds. Well, I hope this video has answered a few of your questions about Losartan. It's a great alternative to other blood pressure medications. Just make sure that you follow all of your doctor's orders when taking it. And if you've experienced any side effects from taking Losartan, let me know below in the comments. I'm curious. Hi there, if you suffer from high blood pressure like I do, and you want to receive my educational videos about how to lower your blood pressure, I'd like to ask you to do 3 simple things right now. Number 1, click the subscribe button right there. And then number 2, click on the bell icon right down there so that I can notify you the moment I release a new video. And number 3, watch another one of my more popular healthy blood pressure videos right over there. Okay, thanks for watching and have a happy and healthy day.